In the areas most affected by COVID, some local authorities are losing patience with the NHS test and trace system. On Saturday, it was Sandwell. Today, it was Blackburn with Darwen Council in Lancashire, who said it was launching its own contact tracing scheme. Parts of England's test and trace scheme are run by Public Health England. The centralised call centre and online system is outsourced to companies and went live on the 28th of May. Experts say that over 80% of close contacts of infected people need to be reached for controls to be effective, but many areas fall short of this.
We know that currently from the test and trace programme that around those non-complex cases, community cases, around 50%, a little bit more of contacts are reached within 24 hours of the case being handed over to test and trace. But we want to try and get that up as high as possible.
Newsnight has heard from sources within Public Health England, and they shared the concerns they had. This included poor communication between different parts of the system. So, for example, if the centralised system picked up a person they thought was responsible for spreading coronavirus around the pub, they had no way of contacting them to find out what action they had taken and had to start from scratch.
They've had £208 million for 12 weeks. They've employed 27,000 call handlers at £20,000 a year for the 12 weeks. And these call handlers have traced fewer than 56,000 contacts. That means less than 2 per call handler over the 12 weeks. And of those contacts, they've only reached 1 each.
Professor Pollock says the centralised system is inefficient and also suggests there are problems with communication.
When the privatised system are being given the contacts, say there's a household of 6, instead of that going to 1 call handler to deal with the whole family, they allocate 6 call handlers, 1 for each member of the family. And what happens is the same family has to repeat the questionnaire 6 times, and they get fed up and then they refuse to participate.
Some in local authorities argue that there are reasons that they may be able to do a better job, and when the contracts for the centralised system come up for renewal, they should do it themselves.
It's as simple as the people that we're using to conduct contact tracing being more familiar with the communities that they're serving and being more familiar with the areas. For example, if somebody tests positive in Oldham and needs to be traced, then the GP often makes contact, and that is somebody that is trusted by the person that is receiving that contact. So when they're receiving advice from a local GP, it goes down much better than if they were to receive it from somebody dialing in from a national call centre. On top of that, of course, we have quite diverse communities in Oldham, and we've had outreach workers embedded in those communities over periods of years.
Today, a modelling study stressed the need for an effective test, trace, isolate strategy to identify symptomatic people to be in place to limit any outbreaks as schools reopen. Dido Harding, in charge of the NHS Test and Trace service, says they've been in touch with local authorities since the beginning.
Remember, this is a service that is 2 months old, and so we're getting better and better at it. Local authorities are getting better at it, and together we're developing better ways of sharing data and accelerating the process of contact tracing.
Some experts say contact tracing cannot find everyone, and some are cautious in how much it can achieve. But as we move into autumn, will the government be able to make the necessary changes needed to ensure the test and trace system works as well as it can?
Deb Cohen, well, we put this to the Department of Health. A spokesperson told us that the NHS Test and Trace Service has now contacted more than 218,000 people who tested positive for the virus or recently been in contact with someone who has tested positive. They highlighted the work they've been doing with Public Health England and local health officials. Well, we asked the government if they would take part, but nobody was available. I'm joined now by Professor John Edmonds, a member of the Government Scientific Advisory Group for Emergencies, SAGE, and the epidemiologist at the London School of Hygiene and Tropical Medicine, and Councillor Alan Brett, the Labour leader for Rochdale Council in Greater Manchester. Good evening to you both. First of all, Alan Brett, what do you need from the national system that you're simply not getting?
Information and help with that information, give us the resources to contact the people. I think Sean said it before, that we know and we know are there.
So if you're not getting the right information, do you feel that you're letting your local people down?
Well, we're not letting them down. Perhaps the government is. Why the government can't do this locally, I don't know. We know they get tested. We've got more testing going on, or almost more testing going on in Rochdale than anywhere else in the country. We're the 6th highest, and the results are there within 48 hours or less. So once they got the result and the postcode, why can't they let us know and we can try, trace and track them?
Well, funny, we were just saying earlier, I was saying in my introduction that Blackburn started its own local one. Do you think that in Rochdale you're going to end up having to do the same thing? I
think we may well have to, yes.
That's what you'll do. John Edmonds, a lot of this is about public confidence. And when you hear Alan Brett saying there that really they want information, they can't get information, they can't get postcodes, it means the public does not have confidence that the government's getting it right.
Yeah, it's not ideal, is it? This is the system that's supposed to be in place in order for us to ease the restrictions. And so it needs to work. But, we've been easing the restrictions over the last few weeks and cases are going up. So it's clearly not taking the strain as we hoped it would do.
So this idea that we were going to have a world-beating system was nonsense?
Honestly, I couldn't care less whether it's world-beating or not. I just want it to be virus-beating, and it's not. And it's not. So a number of issues here. What data do we need that we're not actually getting and that is not getting to every single local council? What data do we need? Simply, is it just postcodes? Is it phone calls that are being guaranteed? What's not happening? I think there's a range of different things that are going on. So one, I think the system is quite clunky. You had an example given in your report just now. And so it does take quite a lot of time to get the information out of each case about their contacts. And so I think, they might give the initial information and then start to get a bit sick of the whole process and give up. And I think that's a problem. And so that's a problem for just collecting the data. Yeah. We also, our metrics, they collect metrics about how well they're doing, the NHS test and trace. But as epidemiologists, we kind of want other metrics to be measured, and they're not really doing that at the moment. So it's hard to say just how well they're doing. So on track and trace, should people be quarantining straight away rather than waiting, for example, being told that they've been close to somebody and that they could have the virus, but actually they don't quarantine until they find out whether 48 hours later that they are positive or not? Yeah, so this was designed into the system at the beginning. There are different ways to do this. So you can take a more stringent approach, which is done in other countries, whereby when the index case, the first case, just has symptoms, so they have just suspicious symptoms. They haven't been tested yet, but they have suspicious symptoms. And what you can do is you can then contact trace their contacts already and ask them to quarantine. But we're not doing that. And if the case comes out to be positive, they stay in quarantine. And if the case comes out to be negative, you release them. So with this uncertainty that exists at the moment, Alan Brett, you are talking about the children in your borough going back to school in 4 weeks' time. Do you think that is safe? Are you going to have to make a trade-off? Are you going to have to close something else in order to let the children go back?
No, we won't let the children go back if it isn't safe. We have all the systems in place in the schools. The schools have been prepared, the schools have been cleaned, the schools have been made ready, and therefore we hope they can go back, provided the government gives us the assurance that the system is working. So wait a minute, you're actually determined that if you don't feel it's safe, you will not send children back? No, I don't think it's a case of that we won't send them back. I think their parents won't allow us to send them back. Remember, we're the custodians of the guardians of the pupils, so we want to send them back. The parents, I think, want to send them back, but the parents want to have confidence in the system. Professor Edmonds, you're a member of SAGE. SAGE's advice to the government was to open up incrementally.
But then what happened is the government didn't follow your advice. So what do you say to that? If the government doesn't follow the advice of the scientists, what happens?
Well, they have to balance different things, don't they? They don't just balance the epidemiology, but they have to balance the impact on the economy. That's fine. They have to do that. It's right. Sage said all along that things should be done very gradually, incrementally, and evaluate step between each step. It hasn't quite worked out like that. It has been incremental, but we haven't done step by step. There's been 2 or 3 different things that have come in together. Like in July, there was a range of different measures that came in place. So it's hard now to evaluate which of those were the most important. Clearly, cases are starting to go up, and so those easements that happened in July, tipped the reproduction number above 1, just a little bit above 1, it seems. But which one of those different measures was the most important? So we don't know. So it's hard then to reverse the most important one. So we don't know which one that is.
So we're going to get ourselves, in a sense, into more of a kind of uncertainty than more of certainty. Until we get a vaccine, there's great uncertainty. And do you think, until we get a vaccine, we are going to move into a system where we simply test every single day? We test, because that's all we can do.
We will be doing an awful lot of testing. I don't think we'll be testing the entire country all the time. I think that's a bit too much. But we might have to step up our testing significantly. So, for instance, if there's an increase in cases in a local neighbourhood or something, have to go to test everyone. I mean, that's the sort of strategy that is followed in China and elsewhere. Where you test everyone in a locality where there are cases. And especially with these new tests that are coming on stream that can do it on a saliva test, which is much less invasive, and they can be turned around much more quickly. So I think it becomes feasible that you can do those sorts of things. And I think we might be seeing those sorts of strategies emerge now in the coming weeks and months.
Thank you both very much indeed.